Yield to Dr. Bera.
Thank you, Mr. Chairman. Thank you for the timely hearing here. Obviously, this is an esteemed panel. As a physician who has done public health work in Nicaragua in areas that we're finding endemic of certainly dengue fever when I was down there, but now with Zika virus, this is going to be a challenge. Certainly, the mosquito we're dealing with is not an easy one to eradicate, not an easy one to prevent. But the purpose of this hearing is to make sure we get information out and also dispel misinformation. And in epidemics like this, that is incredibly important because lack of knowledge, because the spread of misinformation certainly can create panic. And what we want to do is reassure the public that we are taking this outbreak and this epidemic very seriously, but we're doing in a responsible way. I look forward to the testimony of our witnesses on, how we're approaching this, the steps that we need to take. I applaud the President for his request of $1.8 billion, how we best can utilize those funds. But there's a lot that we don't know. I mean, we've got to come up with more rapid diagnostic tests. We've certainly got to, understand the extent of folks that are infected, but also the fact that the vast majority of folks that do get infected, probably are asymptomatic. We also know that there is heightened risk in women of childbearing age and certainly women who are currently pregnant. Certainly want to hear the testimony of the witnesses with regards to what we can be doing. But as a physician myself, certainly one thing we can do in endemic areas is liberalizing access to contraception, making sure that more women of childbearing age in endemic regions have access to full contraception. This isn't about abortion or not abortion. This is about, making sure that those women who are not planning on getting pregnant have the ability to prevent that pregnancy until we get a better understanding of what we're dealing with. And I would make a strong push in endemic countries to dedicate some of those resources to access to those family planning services, to access to contraception, to access to birth control. Again, incredibly important. For U.S. citizens that are planning on travel, obviously if you're of childbearing age, we would urge you to take the caution. If you're pregnant, again, I would hear what those travel restrictions are, but my sense is we would urge those women who are currently pregnant not to travel to endemic areas. In addition, I'd be curious, it is my sense that given the interconnectedness of the globe, we've started to see some Zika virus cases pop up in the United States. Epidemiologically, I'd be curious. My sense is these are generally folks that have traveled to endemic areas who are now returning. I'd also be curious about the epidemiology in terms of where we're seeing the virus. It sounds like we may potentially be seeing it in semen, we may be seeing it in saliva and other bodily fluids. So what we can do in terms of recommendations there. Again, I applaud the panel here. Again, looking at this as a healthcare professional, I would urge that we don't panic. I would urge that we collect the data, the information. If folks are traveling to endemic areas, obviously take the usual precautions to prevent mosquito bites. If you're of childbearing age, certainly take those precautions. I would urge that we do use some of the resources that the President has requested to make access to full contraception more available for women of childbearing age in these endemic regions. That is one simple thing that we can do to prevent, the congenital abnormalities and so forth. And again, I don't think anyone argues that that isn't good medicine and good prevention. So again, you'll look forward to the testimony of the witnesses. And again, thank you.